The International Commission of Jurists is urging the African Union to acknowledge that COVID-19 vaccines are a public good. The International Human Rights Group wants all African states to ensure access to these vaccines in order to realize the human rights of their inhabitants. The African Union will be holding its 34th Ordinary Summit this weekend, and the ICJ wants the organization to call on all member states to endorse and fully participate in the World Trade Organization's COVID-19 Technology Access Pool. To tell us a little bit more, we're now joined by the Director of the African Regional Program of the International Commission of Jurists, Kaajal Ramjathan-Keogh. Thank you so much indeed for joining us, and welcome to the program.
Good evening, Peter.
All right, so tell us a little bit about this letter that's been sent to the President of the Chairperson of the African Union, President Ramaphosa. What have you written to him saying?
So the International Commission of Jurists are global advocates for justice and human rights. This includes the right to health. In line with these rights that we are advocating for, we've made this submission to the chairperson of the African Union. The African Union has a key leadership role in directing cooperation which is grounded in international human rights law standards, including the right to health. What we've asked, and this is based on international human rights law, is that the African Charter on Human and People's Rights, to which most AU member states are party, provides that every individual shall have the right to enjoy the best attainable state of physical and mental health. The Charter also places an obligation on states parties to take all necessary measures to protect the health of their people and to ensure that they receive medical attention when they are sick. This obligation must also be understood with the equivalent Article 12 of the International Covenant on Economic, Cultural and Social Rights, to which most AU member states are also party. That provision protects the rights to the highest attainable standard of physical and mental health and requires states to take all necessary measures to realize this right, including to ensure the prevention, treatment and control of epidemic, endemic, occupational and other diseases.
All right, so we've used the word public good and that it's a right, not a privilege. Take us through that. What is a public good? And I can almost understand a right from a privilege.
Vaccines are a public good and should be treated as such by states. This understanding was confirmed by the UN Committee on Economic, Social and Cultural Rights in December 2020 in a statement on universal and equitable access to vaccines. The UN Committee stressed that every person has a right to have access to a vaccine for COVID that is safe, effective and based on the application of the best scientific developments. It further implored states to give maximum priority to the provision of vaccines for COVID-19 to all persons. The ICJ recommends that the African Union acknowledge that COVID-19 vaccines are a public good, and all states must ensure access to these vaccines in order to realize the human rights of the inhabitants of their countries. A public good, in contrast to a private good, is something from which no one can be excluded, and the good's consumption does not reduce its availability to others. The COVID-19 vaccine must therefore be accepted and understood and treated as this public good.
So what do you do with a country that perhaps is slow or reluctant to provide vaccines? You know, we've just seen Tanzania recently saying that they're not getting this vaccine for some time. And the president himself has said that we're going to rely on God. Does that mean that the citizens in this country are having their rights deprived?
Tanzania's constitution guarantees both the right to life and the right to health. Furthermore, the right to life is also guaranteed by the Universal Declaration of Human Rights, the International Covenant on Civil and Political Rights, and the African Charter on Human and People's Rights. This refusal by Tanzania's government to acquire vaccines may be challenged in domestic and regional courts and by citizens and residents of Tanzania. We have seen similar situation happening in other countries. In Zimbabwe, an NGO called Zim Rights has just filed a case demanding that the government disclose the budget, plan, and time frame for the rollout of a COVID-19 vaccine. This action in Zimbabwe is premised on the right to life and is also based on domestic and international legal obligations. We can expect to see more and similar cases filed in countries which are not taking active measures to acquire the vaccine, and these could in time even be followed by wrongful death suits if no action is taken to protect people.
All right, let's go back to the letter because it does contain some recommendations for the AU that you're hoping that there'll be resolutions and that they will adopt. Take us through what these recommendations are.
So the ICJ calls on the African Union to adopt these 5 resolutions, calling on all member states to ensure that their COVID-19 responses, including vaccine acquisition and distribution, comply with international human rights law and standards, including those particularly relating to the rights to health and to duty, to ensure that this right is realized through international cooperation. Second is to call on all member states to endorse and fully participate in the World Trade Organization's COVID-19 technology access pool. Third is calling on all member states to openly support the approval and implementation of a waiver of intellectual property rights in terms of the TRIPS agreement in order to ensure equitable and affordable access of COVID-19 vaccines and treatment for all. Fourth, to call on all member states to urgently publish public comprehensive vaccine rollout plans and transparently provide clear and full health-related information to their populations. And finally, calling on all participants in COVAX to endorse and fully participate in the WTO's COVID-19 technology access pool.